Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help you and your families to feel better, function better, and live as many quality, disease-free years as possible. Thanks for listening to me this week, and today marks my 100th show. So, no, I'm not in a room with a bunch of balloons and any noisemakers, but I really wanted to thank you all for listening to me. As I started off on this journey 100 shows ago, figuring that after a few shows, somebody would catch wind and throw me off the air, and maybe the subject matter that I was discussing with you guys was one that people would maybe not be interested in. As a public speaker for the last 20 years, I'm used to speaking to groups of people, not an empty room recording into a microphone. But after the first 5, 6, 7 shows where I know my mother was listening, and thanks for listening, Mom. She was my critic. She would call me on the phone and tell me I was doing a good job. Thank God for mothers. And it's interesting over the last 2 years or 100 shows, how many people have actually I've come in contact with, and it's really been a blessing for me to hear your feedback, and all things through Christ. And it's not my effort, it's His. And I am very thankful for the opportunity to be part of Tandem Radio, which is part of the Bridge FM. And I just wanted to say thank you to everyone. And it's interesting because last Saturday I spoke at Monmouth Worship Center as we kicked off the By Design ministry. We did a ministry and a fundraiser for Solutions Pregnancy Center down in Shrewsbury. And we had about 150 women. It was a women's only seminar. We had a breakfast, and then I spoke, and I just want to thank everyone down there. What a wonderful group of people in a great church, and it was a very, very special day for me. I'll never forget it. And I've set aside about 12 By Design programs per year. So if you have a church or organization that you'd like me to speak at, please contact me. My last name is spelled Proodian. You could email me at jproodian@naturalhc.com, or find me on the internet, and I'd be happy to set up an event for your church or group. The minimum requirement is 50 people. I just need a group of 50 or more to speak to, and we'll be doing these as fundraisers. People could give a love offering at the end of the event. No pressure. I make no money from the event. I self-fund it, so there is no out-of-pocket expense for the church. It's just part of my way of providing in ministry work. So thank you for everybody in our Monmouth worship again, and it was a great week. So here I am at show 100, and we're talking about chronic illness. We started on week 1 talking about chronic illness, and I'm sure that if I'm blessed and by the grace of God to be here at show 200, I'll still be talking about chronic illness, because the epidemics of chronic disease are here, they're alive, and they need discussion. I think we, as a society, really need to grow up and understand what's happening to the citizens and the people of this world through man's design. And my show is designed to talk about what man has done to God's plan. God had set forth a plan, and the plan was a physical, a nutritional, and a psychological plan for us. And it's very, very clear, and man has greatly distorted it. So chronic disease, as we talked about last week, we're using Dr. Jeff Bland's book right now called The Disease Delusion, and I can't recommend Dr. Bland's work enough. He is the father of functional medicine. This is a world-renowned author and PhD. He defines chronic disease with 4 characteristics, and those 4 characteristics is, number 1, they do not heal themselves. Second, they grow worse over time. Third, a chronic disease does not have a single cause, and multiple factors are typically the cause of it. And number 4, chronic disease or illness has a very complex symptom profile. So that sick person has a number of ways that they're presenting to an office like mine, where a medical profession, which was invented, let's say, 100, 150 years ago, or in the last 100 years through the advent of antibiotic therapy, our doctors are typically looking at us not so much as a overall system, but as individual parts. And this is part of the conversation I want to have with you today, which is on chronic illness and you guys doing a self-check for yourselves today, but also remember, guys, when you go shopping for a car, you're a consumer. When you go to the food market, you're a consumer. When you choose your medical professionals, your healthcare professionals, you're also a consumer. I remember my wife and I, we have 5 children, and when my wife Stacy was pregnant with our first daughter in 1999, I remember having to go out with her and research who was going to be, the OBGYN, who is going to serve basically my wife during the 9-month period of time of her pregnancy. And there is nothing wrong with talking about healthcare providers in that way. This is your health. We're looking to obtain optimal health while we're here. Okay, while we're on this side of eternity, we want to feel well. We want to function well. This is barring tragedy and trauma. I'm not naive to that subject matter. But if we're living a life, a godly life, and also following God's plan for us, we want to have professionals, healthcare professionals in our life that are equipped to serve us in the best capacity possible. So that means we have to be consumers. We have to know what questions to ask. We have to be prepared before we go to our doctor's office. Being prepared does not mean printing off hundreds of pages off of web.com, walking into your doctor's office and expecting him or her to go through 100 pages of data that you printed off the internet. Being prepared means kind of having a sense of what it is that's ailing you, having a sense of digging deeper, not just saying, like for instance in the case of the third point of chronic illness, that it does not have a single cause. If you're fatigued, if you're tired and blood reports are run on you, and let's say the bloods come out relatively normal, you don't have anemia for instance, or maybe you're dealing with a little bit of anxiety or depression, dig deeper. Maybe the problem is actually in your gut. We talked about leaky gut syndrome. We talked about gluten sensitivity. The goal of these conversations with you guys is that you think differently. Remember, we're part of the counterculture. That means we're not going to participate in this world, in a fallen world, as Christians, right? We've become a counterculture to the secular world. Well, we also have to look at our health in a similar manner because chronic illness epidemics, which are plaguing our country. I read a statistic to the audience last week that right now our healthcare costs are 18% of the GDP. It's going to 34% in the next 20 to 30 years. Now that's an unsustainable growth. So people are getting sicker and sicker. So let's take that healthcare consumer idea. And this is for you. You have your health journals out and we're going to start jotting down some notes because what we're going to be doing is taking a self-assessment. Let's ask ourselves some very honest questions. And you should be asking these questions and writing them down. And I could email them to you if you'd like before you go to your doctor's office. And if you don't feel as though the doctor gave you the time, the attention, and the thoroughness, then it might be time to shop for a new doctor. And that's very important. And I can't recommend functionalmedicine.org enough, where you could search for a functional medicine doctor, someone who thinks multidimensional, someone who's thinking, just like, for instance, if somebody comes into my office like they do every day with back pain or sciatica, I'm also thinking about their gut. I'm also thinking about their thyroid. I'm thinking about their blood analysis. I'm putting together a comprehensive approach to their health, not a single dimensional approach of, let me just get rid of your back pain, because your back pain's origin might not just be mechanical. Okay, so let's look at this health assessment. Some questions for you. Do you feel your health has gotten worse over the last 2 years? Have you gained or lost more than 10% of your body weight over the past 5 years, even if you weren't intentionally doing so? Do you have trouble going to sleep or staying asleep? Now, I know I got some pens out there writing about that one. Going to sleep or staying asleep, very important. Does pain in your joints or muscles limit your physical activity or mobility? What that means is, are you waking up and throughout your day, you might have to pop an Advil, every now and then. You have to pop this or pop that. Your back hurts, your knee hurts, your ankle hurts, and it's kind of limiting you as you go up and down those stairs. Maybe as you attempt to squat down, you have to go to your knees, things like that. Next one, you commonly fatigued. Do you feel anxious or depressed, or do you have like brain fog throughout your day? You can't concentrate the way you used to, or problem with your memory. Next one, is there ringing in your ears? Okay. Do you feel as though you're losing your strength? This is a big one. You guys, having strength, muscular strength, is the key, one of the keys to longevity, meaning the stronger your body is physically, the longer you will live. Okay. This is a very, very important subject matter to me, because I feel as I look at our society, we've gone from being farmers, which were very physically active, strong people. I mean, I don't know about you, but if you've ever shaken the hand of an 80 or 90-year-old farmer and you feel like it's a vice, I mean, these men and also women are very strong. We've abandoned that lifestyle, and we've taken sedentary jobs where our bodies decondition and we become weaker. Next one, do you take prescription medication? Do you take more than 2? How about over-the-counter medication? Do you commonly take things like anti-inflammatories, antacids, analgesics, sleeping remedies? Okay, do you suffer from allergies? Okay, so we're doing this self-assessment, and you're kind of going through this list. And you're saying, yeah, I do that, I don't do that, but let's continue. Do you occasionally have episodes of poor concentration or confusion? Do you commonly suffer from shortness of breath, or do you feel winded? If you have to run for the train or the bus, or, take stairs really quickly, do you feel as though you're out of breath? If you felt as though you've lost muscle mass over the last few years, and if you've heard from your doctor that you have elevated blood pressure, elevated cholesterol, elevated blood sugar, glucose, okay, these are very, very important. If you have frequent constipation or diarrhea, or if you just have discomfort down, in your belly area, and if you've ever been, if you seem to be catching colds or flus that are going around, if you're the one who it's September now, and they're all coming into my office right now, and, all of the people who have the most, who caught the newest cold, who have the knee infection, and, everybody's coming in, and right when the season changes, right when the temperature changes, if you're the person who has a tendency to being sick. So let's kind of connect some dots. Last week, we talked about chronic illness. Dr. Bland did a great job illustrating the 4 points of chronic disease. Then today we did a self-assessment. You might be sitting there saying, yeah, I have a bunch of those things going on. Now let's think here for a second. We go to our doctor and we have a sinus infection. We get an antibiotic. Typically our doctors are not asking us about our gut. They're not asking us, oh, you also have high blood pressure. Oh, you have some labored breathing when you take the stairs. Oh, you have an allergy or a subclinical allergy, which is one that, is not like you're having hives or itchiness or an anaphylactic reaction. But you've got multiple conditions, and yet most of the time, doctors will treat the symptom that's in front of them. You have high cholesterol, we're going to give you cholesterol medication. You have high blood pressure, we're going to give you a blood pressure medication. Oh, now you have a 102 fever and you have a sinus infection. Now we're going to give you Z-Pak. So we have to step back, all of us, and say we're going to be better healthcare consumers. We're going to look for better doctors who are going to treat the entire individual. Because this new wave of thinking, and this new wave of thinking has been coming for 20, 30 years. This is not new to me. It might be new to you guys who are listening to this, but there are clinicians all over this country who practice this way. My attitude towards my wife's OBGYN back in 1999, or our pediatrician that we had to choose, who I interviewed after or right before Hannah was born, my first child, was very important. I want to know what the thought process was. I want to know if I could be a participant in making decisions about my children's health. And so as you go through, and we all have our lists of professionals in our lives, who maybe washes the car, where do we take the car when it breaks, or where do we get our hair done, our nails done. We have our list of people. We all have people, oh, I got a guy for you, or you always hear that, I got a gal for you, she's great. When you look at healthcare providers, you may not always want to take just someone else's opinion because they like the person. Listen, I'm really happy my patients like me, but outside of them liking me, it's more important that my job I'm doing is being done thoroughly. And I think that as a healthcare provider, it is critically important that we look at all of these components. And I use the word healthcare consumer because as a doctor looks at you, I want to make sure that you are obtaining optimal health by the grace of God, by looking at God's plan. And looking at God's plan many times begins with taking a real hard look at ourselves. So that's what today's self-assessment was all about. Starting the process. These things do not heal themselves, guys. So you have to take the self-assessment, find the right provider who's going to work with you in reversing chronic illness. Thank you for joining me this week, Dr. James Proodian, on the By Design radio show. If you have any questions for me, please go to ProodianHealthcare.com and submit any questions. And thank you once again. It has really been a blessing to serve you guys. This is my 100th show. Luke 137, for with God nothing is impossible, and By Design is a testimony to that. God bless you and have a great week.